It is only getting worse. John, Alisyn?
All right, Nick, thank you very much for all of that. We will speak about it for the next hour. Thank you. But let's get right to the breaking news on the possible progress on a vaccine. Let's begin with CNN Chief Medical Correspondent Dr. Sanjay Gupta and Dr. Ashish Jha. He's the director of the Harvard Global Health Institute. So, Sanjay, the news that were just being reported this morning, Moderna, that drug company, is moving into phase 2 of the vaccine, meaning that phase 1 went well enough that they're making progress. I know you talked to the folks at Moderna yesterday, so what do you know?
Yeah, I mean, and they just released a press release as well about some of that phase 1 data. Very early, but if it holds up, very encouraging as well. There's two major points here. When you're doing these vaccine trials, the first phase is really to look for safety. And so far, the safety data does look pretty good. Again, they got to analyze that. But they also looked into trying to figure out, in response to these vaccines, were people developing antibodies, a term that people have come to know, but basically it's the body's response to a virus. And they want to make sure the antibodies, which could fight the virus later on, were in fact being produced when given this vaccine. And the answer is yes, at least in these early results. And not only were antibodies being produced, but as you increase the dose of the vaccine, you were producing more antibodies. And these are the type of antibodies that are known as neutralizing antibodies. Okay, so what that means is you take some virus, you take some of the antibodies, you put them in a test tube together. Do the antibodies actually neutralize the virus? And the answer again was yes. So again, this is encouraging. Very early data. We knew they were going to phase 2. There still has to be a phase 3 after this. So there's a process here that still needs to unfold. But we didn't get bad news at this point. We didn't get the answer that this doesn't work. It's not actually eliciting a response. The news so far is good. We're going to keep a close eye on it.
This is with 8 participants in a study right now. 8
That's
people.
Right.
It's small, but it's exactly what you want to see among those 8 participants, producing the neutralizing antibodies at the level with which they did. And Dr. Jha, one other aspect of this, Moderna says they're going to advance to phase 3 by July. That's widespread vaccine testing. What does that tell you?
Yeah, so I want to just, excuse me, good morning. I want to agree with Sanjay first that this is good news. And while we should be cautious because there have been plenty of cases in history where we have not been able to get from here all the way to end product, this is everything I'm seeing so far makes me optimistic. In terms of, if they can enter into phase 3 by July, again, the goal of being able to get to a vaccine by early next year, I think becomes more realistic. So fingers crossed that this is heading in the right direction.
Okay, Sanjay, I want to ask you about another story that got my attention over the weekend, and that is that these 13 sailors on board the USS Theodore Roosevelt, so first it was 5, then 8 were added, now a total is 13, they came down with coronavirus, as did many of their shipmates. They then isolated for 2 weeks. So they had symptoms, they isolated for 2 weeks, they had no more symptoms, they tested negative. They then developed symptoms again and tested positive. What does that mean? When you hear that, obviously that gets a lot of people's attention. If you can get, the thinking is that you might be able to get coronavirus twice, but what do you, from your medical perspective, hear there?
Well, I'm going to go out on a limb a little bit here because, we're hearing a lot of back and forth on this over the last few months. Here's what I think. And again, I'm going out on a limb. But I think once you're exposed to the infection, the chances are you develop some antibodies and you do have some protection. I don't know how long that protection lasts. I don't know how strong it is, but I think it just, from everything we know about how the body works, once you have the exposure, as we were just talking about with the vaccine even, once you have the exposure, you do develop antibodies. I would find it very hard to believe that these sailors were reinfected. I don't know exactly what happened here. Did they have false negative tests at some point? Are they finding remnants of the virus that aren't actually the virus itself when they test again and they get a positive result? I don't know how to explain it exactly, but it doesn't make sense that they would get reinfected in that short duration of a time. I can't say that for sure. I'm trying to say these things with a lot of humility because we're all learning as we go along. But from everything I've known, I've been a doc for a long time. Ashish, I'm curious what Ashish thinks as well. But it just doesn't make sense that reinfection is the explanation here.
Dr. Jha?
Yeah, I'm with Sanjay. I'm pretty skeptical that these people, these sailors, got reinfected. Again, there's a lot here we don't know, and we should be humble. But everything we've seen from all the experiences in East Asia, in Europe, is that once you get it and once you truly clear it, you should be good to go for a while. Is that 12 months, 18 months, 6 months? We don't know. So I'm guessing that there's an explanation here that's not about people getting reinfected.
I wonder if we can put up the map of the United States, which has become this quilt that we're looking at every day about where cases are rising, the number of new cases going up, and where they're dropping. And it's about equal. It's a third, a third, a third. In 18 states, the number of cases, new cases are dropping. In 15, it's steady. In 17, they're going up. And Sanjay, one of the states we're looking at most closely this morning is Texas, where they had their single biggest spike in new cases over the weekend. Now, there may be reasons for that. It may be because they're testing more. It may be because they're testing more around meatpacking plants in Amarillo, where these cases have known to come out. But what does this tell you?
Yeah, I think that they are doing some more directed testing, and I think it's going to be this thing where the numbers are going to be harder to interpret because you test more, you will find more, and we're increasing testing. I think, the way that I look at it is that the virus is still out there. I mean, it is still circulating. I wish it weren't, but it is. And as people start to come in closer contact with each other, especially in situations like, bars or close quarters like that, the virus will spread. I mean, that's going to happen. When exactly we will see the reflection of that in the numbers, we know that between the time of exposure to the time of testing can take some time. It takes longer if people are hospitalized. Most won't be, thankfully. And then the death counts, these tragic death counts, that could be weeks, away. But I hate to be the guy to say this. I mean, no one likes to say this, but the numbers will go up in response to reopening. They will. I don't know when. They will happen. They may be less of an impact in some places compared to others, depending on density and depending on whether people actually, despite the fact that they can go out, do go out. Just because states are reopened doesn't mean that everyone is back out all of a sudden like they were back to normal in December of last year. But the numbers will go up.
Dr. Jha, what's your take on that? Because obviously we are right now embarking on a new experiment. We've never been here before. So 48 states as of today are reopening in some form. And I understand everything that Sanjay has taught us. There'll be a honeymoon period where for a while it will seem great and there won't be new cases. And then it stands to reason that we'll see in some places cases spike up again. However, hasn't the virus been eradicated from some communities? Haven't some towns cleared all their cases? And if people go out there, are they safe?
Yeah, so I think, what we're going to see is a lot of variation. There are going to be states that are doing it carefully, that have adequate testing, that I think are going to be able to keep their caseloads low. There are other states where I think we'd all be much more worried. They have a lot of cases, they may be rising, and they may not have enough testing given their caseload. I don't know if any community has eliminated the virus. I mean, we know the virus is circulating. Even if a certain town or let's say a state doesn't have it now, people are going to travel. People are going to go from town to town, county to county, state to state, and the virus will get reintroduced. So we all have to remain vigilant. And I think we have to let data drive our decision making. And right now, the data is concerning in some places, and other places it's more reassuring.
It's interesting because you look at the states, there's a lot of noise in states like Texas and Georgia and Iowa, numbers going up and down. There are a couple states where it's not noisy, where it's crystal clear. If you look at New York and New Jersey, it's abundantly clear that the daily trend of new cases is going down and fairly remarkably down, Sanjay. And these are still the states, obviously. And I'm not saying that everywhere in the country needs to be as restrictive as New York and New Jersey, but you see the direct impact of the policies in place here.
Yeah, I think that's right, John. I mean, I think overall we may need to widen the aperture overall on our time scale. I mean, we understandably follow this day to day. Sometimes these things are measured in weeks and months, not days and weeks. But the other thing is that, to your point, we do have evidence now that these stay-at-home orders work. I guess most people probably realize that by now, but there was even a study over the weekend in Health Affairs that showed that had the stay-at-home orders not gone into place, there probably would have been tens of millions of more people who had become infected. So, we know that it works. We see the trends as you point out. I'd like to see, 14-day downward trends, as was suggested by these gating criteria. And as Dr. Jha was talking about, testing in place. So because we know case counts will go up as you start to reopen, quickly identifying, quickly isolating, preventing them from going into exponential growth is going to be the key. But you're right, John, there is evidence now.
Dr. Gupta, Dr. Jha, I feel healthier just talking to you in the morning. So thanks so much for being with us. I appreciate it.